to provide fire, rescue, emergency medical, and non-emergency services while protecting the lives, property, and environment of our community with a commitment to safety, professionalism, integrity, and care. This is the mission of Charlotte County Fire and EMS, and the responsibility that you, the community, have placed in our hands. It is with this in mind that your Fire and EMS department is pleased to propose a new Community Risk Reduction Plan, the Emergency Triage, Treat, and Transport, or the ET3 model offered through the Centers for Medicare and Medicaid Services. This is to address the continued community medical care in a more appropriate way while addressing the escalating medical needs of our community, along with the increasing deficit in our emergency medical services budget. Today, Medicare only pays ambulance services if they bring patients to the hospital, which you may not need, which can be very expensive, and which may not be the best place for you to get care. This new ET3 model creates an incentive to take Medicare beneficiaries in our communities to more appropriate care facilities, which would be less expensive and would better meet their needs. ET3 will ensure patients get more convenient transports, more appropriate treatments, in more appropriate settings. This model is patient-centered, promoting more options and better controls for their health care. Our current Fire and EMS department runs an average of 27,000 calls a year, with 19,000 of them being Medicare beneficiaries. However, our ambulance services are only reimbursed at a fraction of the services billed. This has already caused a reduction in EMS funding of $140,000 in the last year alone. This is money that will need to be supplemented elsewhere, whether that means greater taxation or a reduction in services. The ET3 model will actually pay, subsidize, and help implement a non-emergency community transport service. Our recent community demographic profile shows that our Fire and EMS department provides services to 160,000 people within our community. This number increases 6 to 8 months out of the year, when seasonal visitors increase our population to well over 200,000 residents. Over half of our residents are 55 years of age or older, and likely receiving Medicare or Medicaid benefits. This also means that many of our residents are living on low or fixed incomes that are federally funded. With only 6 hospitals to provide the needs of over 200,000 residents, this means that one overloaded hospital could change a 20-minute ER waiting room time to well over 1 or 2 hours. This could also mean that residents have to travel farther to less preferred hospitals because local hospitals cannot handle the number of patients. Using ET3, you would still call 911 for your emergency. Our dispatch center would then rate your emergency on a graded scale based on severity. Should your need be one that could be treated at a local urgent care or doctor's office, then a non-emergency transport will meet patients and initiate treatment with a doctor right from their homes. Imagine speaking with a doctor in your house and never having to leave to wait in a hospital. Our doctors will even write your prescriptions and provide referrals for further treatments, all within the convenience of your home. Should our doctors believe your care warrants an urgent care or emergency department, then your Fire and EMS department will help you. Local hospitals, urgent cares, and doctor's offices will also benefit from ET3. Currently, Medicare only covers beneficiaries for emergency room visits. This creates the wrong incentive to bring Medicare patients in Charlotte County to high acuity, high cost emergency departments when lower acuity, low cost settings are more appropriate. This means less EMS services for more critical medical emergencies, less rooms and services at local hospitals, increased waiting room times at hospitals, and less funding for local doctors' offices and urgent cares. Medicare has recognized this poor incentive that they've created and are attempting to correct it with ET3.